Today we've got Anne from the UK coming up. What city is it?
It's from Liverpool.
Liverpool, from the Beatles land. Okay. All right. And Anne, I should say, has a smile on her face here today. She's come up from England to get her adhesive capsulitis frozen shoulder fixed. It's been already a year, more or less, since she fell and felt a sharp pain when she was reaching down into the tumble dryer, and that was the onset. So it's a year old. She doesn't have a lot of pain anymore, but she still has a lot of restricted movement, so it's kind of disabling her from doing all the things she wants to do. Let's take a look and see what she can and can't do here. Let's raise the good arm up first. Good, keep it up there, and without changing the angle of this shoulder, just lift this one up sideways. Yeah, that's right, so otherwise she starts to cheat. Okay, and let's take a look at behind your back. Turn right around, just lift the good one up as far as you can on the other side. Okay, and what different, let's turn back around now then. That's great. What different treatments have you had for this?
I started physiotherapy, but I'd already read about you, so I didn't really have great expectations of it. So I only had 2 visits there.
Couple of visits, yeah.
Yeah, but after reading.
So we went for almost a year thinking it was just going to get better?
So, well, I contacted you, I think, was it about March?
Yeah.
Yeah. And I just wanted to, as soon as I'd read everything, I just wanted to come
Just
here.
wanted to get it fixed.
Yeah.
Okay. And if I hold the shoulder in place without my finger moving, let me look at the good arm. You see that my finger doesn't move at all, so this is the true range of motion of this joint. If I do it on this side, and I hold my finger in place, and I start to bring it up, that's actually the full range of motion of that joint. If I go any farther than that while I'm compressing here, she starts to actually feel restriction or discomfort. You start to feel some pain there, right? Yeah, crunching you can't really do. Can't go any higher than that. So that's actually the true range here. So if we look at this, you'll see this is the true range here. This side's going out here. This is as far as this shoulder goes. It doesn't go any farther. So external rotation is severely restricted. Excellent. So what we're going to do now is one of your first exercises, and that's going to be moving your shoulder back and forth this way, and you're going to rub the right side of your face with your hand as you continue to move your arm without letting the elbow come forward. Keep the elbow back and go ahead and move your shoulder and rub the right side of your face. Do it by yourself. You're going to bring your own hands back now slowly. Up. Let up now. And you're going to take it back to where it was. 1, 2, 3. Okay, good. Now we're going to go all the way back on your bum, and you're going to now sit up, okay? Sit yourself up. And you can let the hands go down here. Beautiful. Very nice. Can you get it to the top? Wow. Wow. Now grab your hand with your other one. Put the fingers together. And now raise it all the way. And straighten the elbows. And all the way back. Good for you. It's really good. All right, so here we have Anne. It's less than 24 hours later. Anne up from Liverpool, a land of the Beatles, and that's what it's famous for, isn't it?
It is, yes.
Seems to be.
Yeah, that's right. Okay, but anyway, let's see what Anne can do here today with her after she's had her operation yesterday here at OAT. Let's see what you can do. Go ahead,
Just
go. Yeah, raise it up. Yeah. Good for you. Good for you. And you're thinking that's pretty amazing?
Oh, yeah,
Let's put the hands together.
Incredible from what
Straighten the elbows. Very, very nice.
Get a full stretch, even with a crossover on that, and as you know, that really does put strain on even a normal shoulder.
I wanted her to do that. Oh wow, look at how far back it goes now.
Yeah.
Look at that. Good for you. Wow, wow, wow. That's fantastic. Can you actually raise it up by yourself?
Just the one arm.
Both arms together.
Both arms together. Out to the sides.
Yeah, that would be the most difficult thing to do. Keep going. Keep going. Keep going. Wow, the muscles actually started to come. And put the hands together now, and then straighten it and bring it back. Put them together and bring it back. And when you help it with the other hand, it finally comes in the final range.
Mm-hmm.
Wow, the muscles really woke up, huh? Because yesterday you couldn't do that.
Yeah.
Isn't that great? You've been really practicing, huh? Yeah, good for you. There's a little bit of pain, of course. That's normal, but what a difference, eh? You're out of the woods. Thanks a lot for watching our Trigenics video today. Make sure that you subscribe to the Trigenics YouTube channel so that you're always sent information on the latest Trigenics techniques and methods, as well as the latest Trigenics success stories. This is Dr. O and the Dr. O Show.